Breast augmentation is the placement of an implant into the breast to really improve the volume and the shape of the breast. The breast augmentation procedure is performed under general anesthesia. A small incision is made in the breast and a little pocket is created to place the implant, and the implant is placed. The benefits of breast augmentation is it really improves the volume or size of the breast as well as the shape. It really gives it a much more rounder, fuller appearance. The ideal candidate for breast augmentation is someone who desires their breasts to be fuller and have more shape to them, really enhancing the beauty of their breast. The types of breast implants being used right now are saline and silicone breast implants. The saline is a salt water in a shell, and the silicone is a silicone gel, so it's like kind of a gummy bear shape to it. We tend to do more silicones than salines because the silicone has a nicer, more natural look to it and a natural feel to it. Deciding the appropriate size of the implant is based on the patient's anatomy as well as their dimensions. So when I see them in consult, we will talk about what their goals are, what their anatomy is like, and how big they want to be. I do my measurements and then we discuss a lot of those factors and we get the perfect implant for the patient. The patients that can benefit from the breast augmentation procedure is someone who's looking for an overall improvement in size and shape of their breasts. A lot of the patients I see are mothers that have breastfed, and after breastfeeding is complete, the breast does tend to deflate and they're just missing that volume in their breast. So that is really a common patient that comes in, and that's really someone who we can help. However, anyone who's looking for an improvement in size and shape to their breast really benefits from this procedure. Incisions for the breast augmentation procedure usually is a incision on the bottom part of the areola or in the bottom crease of the breast. They are very small incisions. These are incisions 3 to 4 centimeters in size, and they're very, very thin. So once they heal and they're in those locations, they're very hard to see. The recovery time after breast augmentation is actually pretty quick. Within a few days, they start feeling much, much better. I tell people a week is probably safe to take off work, but I've seen many patients do this on a Thursday or a Friday and they're back to work by Monday. Usually it depends on the patient. All patients will see an immediate increase in the volume of the breast, but what happens over time is that the implant really shapes the breast and it drops into position. So I usually tell people anywhere from about 6 weeks to maybe 6 months is where you can expect to see the final results.